was only diagnosed with diabetes 4 years ago. And it happened after I took a terrible fall and I broke my back. And I ended up having I had 4 fusions done to my upper back as a result of that fall. And then about 6 months later, I developed diabetes out of the blue. So, I'd gone to my family doctor and he had given me some suggestions and put me on medication. And to be honest, I don't think I was managing it very well. I didn't really understand exactly what I needed to do. And one day I was out and around in St. Louis and I heard this ad on the radio from Dr. Branham's Premier Healthcare, talking about maybe getting off your diabetes medicine and really working to kind of manage your health. And so I scheduled a time to go in there to learn a little bit more about his program. So that's how it all started for me. I was taking my blood sugar, every day, and my blood sugar was like all over the place. I couldn't predict whether it was going to be in the normal range or whether it was going to be really high. So I knew that I needed to do something to kind of bring that in and get a better handle on it.
With the medication that your first doctor gave you,
it wasn't really making much of a difference. And part of that, honestly, is that I wasn't managing things well on my end. I wasn't eating the right foods and, so I just sought him out of curiosity, to be honest, because I felt like what I was doing wasn't really making a major impact on my health. Throughout I've been going to him for a year now, and throughout this year I've had blood work done regularly, and there were some other tests that he did at the beginning, a saliva test and a stool sample test, but it's really the blood work, a thorough blood panel, so that he can see not just my A1C, which is important. I needed to bring my A1C down, but it was a lot of other things that were that he noticed on this blood work that was impacting my health. For example, if you have an inflammation, oftentimes that drives up your blood sugar. So he was looking at a lot of these markers on my blood work to see if some of those markers were a piece and a parcel of my diabetes not in good control, which I had no idea about until I started to go see him. And we really started looking at each single thing listed on my blood work, and really looking at everything. So I feel like my whole health has improved in the process. My daughter is a nurse, and so she looks at my blood work every time we have it done. And the last time I had my blood work done, she said, you have the best blood work of any 60-year-old woman I've ever worked with. So that really made me feel good, that a lot of things have really turned around that I didn't even realize were issues. He also worked a lot with diet and what you eat and what you should try to avoid. And he gave, my husband does all the cooking, which is a blessing. So he gave us a huge booklet on recommended recipes and how to provide variety in your diet and get the right kinds of nutrients so that you can reduce inflammation inside your body and in turn lower your A1C. And when I started going there, my A1C was a 7.3, which is in the diabetic range, and I've gotten my A1C down to a 6.1. So I'm not in the diabetic range anymore. I'm in the pre-diabetic range. So he's given me a lot of guidance, but I have done a lot of work this past year to turn things around for myself. Even without the diabetes, I think it's been a great help for me to have a better handle on what's going on inside of me so that I can be the healthiest person I can be. He spent as much time as you needed to ask questions and fill you in and on what you need to know, reinforce what you need to know. It's been very helpful for me. I feel like my energy level has really improved. I just feel better all the way around. And he said at the very beginning, he said, you know what, and I wanted to lose a few pounds. That was, something, but I've never really struggled with my weight, so I wasn't exactly sure how to do that. And he said that all of his patients lose weight once they get this program going because you're eliminating all the processed food out of your diet and you're just making healthier food choices. I mean, I feel like I am really in the best health I've been in for a long, long time. So I'm really grateful for all of that.